Hey, welcome to Pretty Well. Do you want to get to the root causes of your health concerns? Do you find yourself Googling, why do I feel this way? And looking for solutions to feel great again? I'm Lisa Smith, and I too felt exhausted, achy, and like I was aging too quickly. I wanted to look and feel like myself again, and spent way too much time and money going to practitioners, even functional medicine practitioners, and not getting results. So I became a functional medicine practitioner myself and learned how to identify and fix root causes to health issues. The good news is there is so much you can do to reclaim your wellness. In this podcast, you'll find quick, simple, and evidence-based guidance that you can easily fit into your day so your energy will be soaring, your mind clear, and your skin will return to its beautiful glow. Let's dive in. Hey, welcome back to the Pretty Well podcast. I'm Lisa Smith, and today we have an extra special guest with us. We're talking with Dr. Sanda Moldovan, the owner of Beverly Hills Health and Dental Wellness, which is a leading biological dental center with offices serving patients across Los Angeles, the San Fernando Valley, and Orange County. Dr. Sanda is double board certified periodontist and a seasoned nutritionist, which is going to be so interesting to bring these two things together, with an unwavering commitment to natural oral health and to overall well-being. She's the founder of Orasana, which is a natural product line for oral health, focused on nourishing the mouth, the microbiome, and detoxification. Welcome, Dr. Sanda. I'm so excited to talk with you.
Thank you so much for having me, Lisa.
What inspired you to go the route of biological dentistry instead of traditional dentistry as a periodontist?
Well, it was through my own struggles with oral health that I came to take this path. Growing up in Romania at the age of 14, I already had 16 large mercury fillings, otherwise called amalgams or silver fillings. And fast forward, we immigrated to the United States. I went to dental school, and then I wanted to do my residency in periodontics. Being in Los Angeles at UCLA, I wanted beautiful white teeth. I told my friend, take out all these mercury fillings. I want beautiful white teeth. At the time, I knew nothing about safe mercury removal.
Mm.
I became very toxic. I started having headache, neurological problems. I couldn't do my hikes in the afternoon here at our local Runyon Canyon. I didn't know what was going on with me. Finally, I met a naturopath who did a mercury challenge test, a urine challenge test. I still remember when she gave me the results saying, your mercury is off the charts. And I said, and how did I get this? She said, well, it's from your mercury fillings. I was really upset because I went through dental school. No one mentioned to me, hey, by the way, mercury is toxic. You should be careful when you drill on the teeth. No one has mentioned that. So many of the dental students are believing what we're told, that mercury is totally safe, when we know it's a neurotoxin. So it's become my mission to help advance the profession. We need a healthier level of dentistry. And that's really my mission, Lisa, to bring biological dentistry to mainstream in the United States and all over the world.
Such an important mission. I align with your stories. As a kid, I had so many cavities, Dr. Sanda. I definitely ate too much candy for sure, but I think there was something else. We're going to talk about the mouth microbiome. I think there was something going on there. But I ended up with all these silver fillings and went to a dentist probably almost 20 years ago who said, we should really replace all these silver fillings. I didn't do what I do now. I wasn't in functional medicine, functional health. I thought, great, you're the expert. Go ahead and take them out. Nothing. I knew nothing about, I should have beforehand prepared my body for the onslaught of mercury that would have been released. And I should have had a protocol following that. And he should have had a protocol when he was removing them. So like you, I ended up with a lot of health issues from that. And I really appreciate your mission. Most people think of their mouth as kind of separate from the rest of their body. What is one surprising way that people probably don't know how the mouth impacts health in general?
So let's start. You mentioned cavities. I was reading an article this morning about the cavity causing bacteria called strep mutans
Mhm.
how it's been found in stools of Parkinson's patients. And the release of the metabolites of that particular bacteria ends up in the bloodstream. What they've observed is like all Parkinson's patients had higher level of these strep mutans metabolites in their bloodstream, which they think it's correlated to the onset of Parkinson. So something as simple as cavities, right? Most people think, oh, yeah, it's just a hole in the tooth. Let me just clean it. But no, because these microbes in the mouth, we swallow them. They create inflammation and can cross that very fine barrier between our gut and our body.
So, with this elevation in strep mutans in, say, Parkinson's patients, and it sounds to me, if I understand correctly, that like that is also more prevalent in people who have lots of cavities versus people who don't tend to have a lot of cavities. Why would someone's mouth microbiome favor that strain of strep mutans over someone who doesn't have many cavities? What would cause that?
Yeah, the oral microbiome is so dynamic. It doesn't stay the same, depends on lifestyle factors. How good we are about flossing. And let's face it, a lot of people don't like to floss and they don't floss.
Yes.
That's why through my Orasana oral product line, water flossing, it's a huge component of the three-step system to optimum oral health. We must brush, and I recommend calcium hydroxyapatite.
Mhm.
Using a water flosser, especially for those people that don't or can't use string floss because their hands are too big, for example.
Mhm.
And third, popping in a chewable probiotic. It's so important to nourish the microbiome, not just like kill everything.
Yes. Oh, that is so interesting. I cannot wait to talk more about Osana. I went through a stretch of dry mouth. It wasn't Sjogren's or anything like that. I had been tested, but it was this strange stretch of time. It was so frustrating. And I found an oral probiotic that I would chew before bed. I cannot wait to talk about that some more.
Absolutely.
When you talk about if someone is good at flossing, is that as effective as water flossing? If someone is like, yes, I floss religiously, even sometimes more than once a day, what do you find to be the distinctions between water flossing and string flossing?
I did a whole episode on this on my own podcast, the Holistic Dentistry Show, because string floss came onto into the public in the 1800s.
Uh-huh.
Now, a lot of things have been updated. And when we look at string floss, it hasn't really been updated. And people who floss don't use it correctly. The correct way of using string floss is to wrap it around like a C in front tooth, then the back tooth, move it back and forth, then go to the next tooth. Most people, go in and out quickly. So
Mhm.
the water flosser has been shown to be better at decreasing bleeding on probing, meaning the bleeding around the gums, better than string floss, and also at doing this, what I call gum fitness, meaning the water pulsation of the water flosser encourages the tightening of the gums. And
Oh,
why is that important to have tight gums? The gums really seal around the tooth to protect the bone. If the
mhm.
gums are loose, every time we bite into something, the gums have a tendency to bounce back and forth, and that can cause the destruction of the bone around teeth. And then we start seeing gum recession.
Yes, I've had that
Yeah.
too. I'm actually the perfect person for you to talk to. I started that in my 20s. So it sounds like someone like me, lots of cavities as a kid, gum recession in my 20s. Yeah, it sounds like probably my microbiome needed some attention, right? And then dry mouth at some point in some season. Let's talk about what are some of your favorite ways nutritionally that people can improve the microbiome of their mouth?
Microbiome is very complex, and nutrition and diet is a huge part of it, decreasing the refined sugars and carbohydrates. Because when we feed sugar and carbohydrates, we have a yeast overgrowth and the growth of bad bacteria, which can cause cavities and gum inflammation. The mouth shows us what's going on with the rest of the body. If we see gum inflammation and cavities in the mouth, for sure we've got inflammation in the rest of the organs and the rest of the body.
Mhm.
Eating things high in fiber, Celery, for example, has very good fiber. Even apples. Apples have the fiber. Eat the whole apple, not just drink apple juice because that's a sugar bomb. Always have the fiber associated with that. And chew your food well. If you're going to have high fiber, you've got to chew it. And that chewing motion actually stimulates saliva, which is super beneficial in mineralizing the teeth. But the fiber itself cleans the microbiome off the teeth.
Mm. Mm.
Another great thing is to know what kind of microbiome we're dealing with. Super,
Mhm.
super important. Dentistry has changed a lot. So in our office, we do a oral saliva test. It's super easy. You swish, you spit in a test tube, and we can tell, do you have the cavity causing bacteria? Do you have the Alzheimer's causing bacteria? Do you have the rheumatoid arthritis causing bacteria? We're testing for all this because it gets inherited from our parents. That's how we inherit the microbiome.
So, for our listeners who aren't necessarily in Southern California, how can they tell if their mouth microbiome may be out of balance?
There's more and more companies offering this test even directly to the public. So it's called basically an oral DNA microbiome test.
Oh,
The company I work with called Oral DNA, they have lots of resources there, and people can find a dentist in their area if they look at their website who offers this type of testing.
that's great. That's really helpful to know. So, what are some of the mouth issues people should be looking at as red flags?
I always recommend people to look in the mirror and do a little bit of a self exam. It's super important to know where you're at. First thing to look at is the tongue. The tongue tells us a lot about the microbiome. Are we in balance or are we imbalanced in dysbiosis, otherwise called? How can we tell? Well, usually the tongue should be nice pink color. If you have a white coating on your tongue when you wake up in the morning, that's an indication either of candida overgrowth or poor digestion. In that case, I recommend tongue scraping, but also looking at how can I balance my microbiome so I don't get this white tongue in the morning. People have a red glossy tongue that's showing us an imbalance. Potential it can be a deficiency in B vitamins or iron, for example. So super important to check in with our tongue on a regular basis.
Okay, that's great advice. So, everyone listening, at some point today, go to the mirror, stick your tongue out, and look at it. And if you see
Sure.
anything like a white coating or a really pale tongue or a bright red tongue, right? And sometimes that can be with the B vitamin deficiency, that can almost be a little inflamed, right? Larger.
Exactly.
Yeah.
And interesting for women, especially with perimenopause and menopause, there's hormonal changes. And I have women that come to me and say, you know what, I feel like I have burning on my tongue. I feel like I have like a Velcro. And that's actually an indication of hormonal changes. And with bioidentical hormones, that can actually go away.
Boy, I appreciate you saying that. I have had a number of clients who've come to me and said, I have a burning tongue or a burning mouth. Certain foods exacerbate it, but especially in perimenopause, starting menopause, I've had women saying, wow, my mouth, what is going on with this burning mouth and this burning
Mhm.
tongue? So, I appreciate that you have said that that can be addressed through bioidentical hormone replacement because I too have found so many things in the body can be improved just by addressing that with the right practitioner and getting back in balance. Okay.
Yeah, and I love Lisa that he actually had experience with a chewable probiotic
Yeah.
because if somebody has burning mouth syndrome, yes, we have to regulate the hormone, but also having them pop in a chewable probiotic twice a day, every day is going to help diminish those symptoms.
It's really helpful to know. Now, I was a little bit of an unconscious competent in that, and I just would take it at bedtime because I thought, well, I'm not going to be drinking or eating anything for the next several hours, so I'll just pop it in then. But is it best to not consume anything for like a half hour after you take an oral probiotic, or what's the rule of thumb there?
I always say take it the last thing before you go to bed, after you eat and drink, but wait a good hour, let's say after you've taken a chewable probiotic during the day before you eat or, wash it away with a beverage.
Good. So, yeah, before bed's easy. That's really helpful. So there's a lot of confusion about fluoride, natural dental products like natural toothpaste mouthwashes. Let's put some of those things to rest for our listeners because it can be really confusing, especially when you have a dentist. I've been fluoride free for years because I have Hashimoto's, and that was one of the things I learned to deal with. Get
Absolutely.
rid and with my kids too, that's just how I raise them. But we know dentists, we have friends who are dentists, we have a family member, and they're all like, "You're crazy, you need to be using fluoride." So let's talk about that.
You're not crazy, Lisa. You're doing the right thing.
You, Dr. Sanda.
Unfortunately, this is another example how in dental school we are taught, oh yeah, fluoride decreases cavities, but also calcium hydroxyapatite, which is what the tooth is made of,
Mm,
decreases cavities and helps to heal the tooth that has cavities. Fluoride, we know, is also being used on the field as a pesticide. There's a great documentary called The Fluoride Gate, which explains how the fluoride ended up in our water supply. The good news is, recently the FDA has been taking fluoride products for children off the market.
really?
So it's
Wow.
super exciting. The other exciting thing is that two states have banned fluoride in their water supply this year. Those states are Utah and Florida.
What?
Fluoride is a drug. And the problem with fluoride in the water is there's no informed consent. Whenever we do any type of procedure or administer a drug, we have to let people know this is the risks, these are the benefits. Would you like to proceed? Well,
Mhm.
nobody is doing that with fluoride in the water. The states are not giving people informed consent before drinking water. It's not right. In Europe, they don't have fluoride in the water, it's
Wow.
banned. So
Wow.
we're finally going to see more and more states banning fluoride in the water. It's important not to drink fluoride on a regular basis and just have a filter
Mm.
at the house which filters out the fluoride.
I appreciate that. The more you learn, the more you need to learn, but you also, it starts to blow your mind what is in just our normal day to day that we've always been told is safe and okay. And when you learn that it's actually not okay, it's kind of mind blowing. You.
True.
Another great myth is people think that mouthwash is a good idea. They think it's killing all the bad bacteria, but some kill all the good bacteria too. So let's talk about mouthwashes.
You're so right, Lisa. And that's one of the reasons I created Orasana, natural products that focus on nourishing the microbiome and the good bacteria.
Mm.
I would have patients coming in and say, oh, I'm using this mouthwash. I want to kill everything. And some people are using tea tree oil, which is natural, however, way too strong for the oral microbiome. So just
Yes.
because something is natural doesn't mean it's necessarily good.
Yes.
So hugely important to not use mouthwashes for another reason. It destroys the good bacteria that makes nitric oxide.
Mm.
Nitric oxide is hugely important for health in terms of lowering blood pressure and vasodilation, meaning enlargement of the blood vessel, hugely important. So there's been studies on this that people using antibacterial mouthwashes have a lower level of nitric oxide, higher blood pressure generally.
Wow, that's really interesting. By wiping out the nitric oxide in your oral microbiome, you're reducing it in your body. A lot of people take nitric oxide supplements. So, guys, if you're adding beets or something like that to your smoothie in the morning, powdered organic beets, that is for the nitric oxide benefit, which, as you said, it's helpful for increasing the blood vessel size. So, it helps with blood pressure regulation, but also stamina, recovery after working out. Said, I did not know that about the mouth.
Yeah, absolutely. And we don't need mouthwashes. If somebody has healthy gums, the good way to maintain it that way is number one, brush with calcium hydroxyapatite, not fluoride, to
Mhm.
keep the enamel strong. And then, secondly, using a water flosser really helps to keep the oral microbiome in between the teeth and on the outer surfaces of the teeth as a healthy barrier.
Yeah, and to your point, Dr. Sanda, if someone's using mouthwash, a lot of times it's because there's that fear of having bad breath. If that's the case, then that is a red flag. There's something else going on. So rather than
So
covering
true.
that up, we need to be figuring out why.
Bad breath can be a result of poor gum health, gum disease. You can get it from a infected root canal that you don't even know it's infected because they're dead teeth and
Mm.
they just give that bad smell and odor as
Mm.
they're becoming necrotic in the jaw. It
Mhm.
can come from the tonsils, like if somebody actually has bacteria stuck in the tonsillar crypts, that can come out as bad breath. And of course, it can come from SIBO or, further down issues with the GI tract.
Yeah. So when you just mentioned the tonsils, is that what tonsil stones are? I've seen that before, but I don't even know what those things are.
Yes, and that's something I've had to deal with my whole life. I actually have to practice tonsil hygiene, which a lot of people don't think about. But I see it now because I had to deal with it. I see it in my patients. Whenever we take a cone beam CT scan, which is our regular protocol here in the office at Beverly Hills Dental Health and Wellness, we see the tonsils and people that have calcified bacteria or plaque in their tonsils, it shows up on the CT scan.
Oh,
And through our exam, we always look in the back of the throat and I can see the tonsils being swollen. And then what do we do with that? I advise patient, okay, you can use some ozonated water to gargle.
mm,
Probiotics also help to regulate the amount of bacteria that's there. And of course, if they're really stuck in there, then we need to physically remove those tonsil stones that are formed inside the tonsils.
how do you do that?
We can either pop them out, and sometimes I do that at the office, or through gargling vigorously, they just pop out
Oh,
naturally.
okay. That's really good to know. Okay, if someone wanted to improve their health, their oral microbiome for longevity, anti-aging, their best health, where would you start?
I would start at home.
Okay.
Super important to start at home. So, my recommendation is do a self exam at home, find a dentist who could do the oral microbiome test so we can regulate that. My recommendation is 3 steps through optimal oral health via brushing with calcium hydroxyapatite,
Mm-hmm.
water flossing using just water,
Mm-hmm.
and then thirdly, popping in a chewable probiotic. We've done some small studies on our system at Orasana, and we saw bleeding gums disappearing within 2 weeks and
Wow.
people having less sensitivity with their teeth.
Okay, so have you seen improvement with gum recession? About
Yes.
other improvements you've seen?
So gum recession depends
Uh,
how severe the gum recession is. As
Okay.
a periodontist, it is my expertise to treat gum recession. We
Mm-hmm.
have several different modalities to treat, but when do we treat? If the gums are receded 1 to 2 millimeters and they stay the same, then we could just keep the area clean using the water flosser, maintaining a healthy microbiome. And if it's more than 3 millimeters gum recession and the roots are showing, treatment is recommended. The latest treatment that we have is using PRF or platelet rich fibrin, which is actually drawing blood from the patient,
Mm-hmm.
collecting the fibrin, which contains lots of growth factors, and
Mm-hmm.
putting that underneath the gum. That helps us to move the gum upward as well as thicken the gum and rejuvenate the gums.
Wow. That's really I've been through 4 gum surgeries.
Oh
So
my
I would
goodness.
much rather do PRF than 4 gum surgery. So
Yes.
when someone has gum recession, what do you see as the top 3 or 4 reasons for that gum recession?
Great question. If somebody already has thin gums, most likely is that they will recede with
Mm,
time,
okay.
just from chewing function.
Okay.
Another reason is gum inflammation. If somebody has bleeding gums, even if it's a little bit and they leave it untreated, now we see gum recession. That's why in my office, even if somebody has gum recession, we will do an oral DNA test because I want to know, are there microbes there that are causing this recession?
Mm,
Another reason is if people have braces. Sometimes with braces, the teeth are being brought outside of the bony housing of the jaw.
oh,
So because they're pushing up against the gum, then the gums will recede.
oh, yeah, that makes sense.
Hmm.
Yeah, it's
Yeah.
putting pressure on them.
Yeah.
Mhm.
Severe. If somebody brushes heavily on their gums, because some people think, oh, yeah, I heard I have to brush my gums. No, don't have
Mm,
to brush the gums. If you have a good, healthy diet with fiber, that'll take care of the gums. We have to brush at the junction between the gum and the tooth. That's what's the
mm.
most important.
But not scrub. Yeah.
You're right.
Us type A people tend to take it out on our teeth.
We want to do
Yes.
small circles. That's
Mhm.
the best way to really brush around the teeth.
What about cavities. If someone has a small cavity, is it possible to remineralize the tooth? Can you heal it, or do you need to necessarily get that filled?
Yes, you can heal it if it is into the enamel portion and is actually not a hole yet. How do
Okay.
we determine this? With dental x-rays.
Okay.
Super important to get checkups because when the cavities are found and they're small, they can be remineralized or healed. How do we do this? In our office, we use ozone. Ozone is great because ozone in the form of either water or gas can destroy the strep mutans that we talked about in the beginning of the show. The strep mutans will pretty much disintegrate at the touch of ozone. And then we can add calcium hydroxyapatite as a treatment overnight. So somebody will do this at home every night to help strengthen the enamel and remineralize.
So, if someone, how do they find someone who could help them with ozone? Say the majority of our listeners see a traditional dentist or a periodontist. What do they do? How can you find someone who uses ozone in their office, or is there an alternative they could look into?
The best solution, I say, go to IAOMT.org.
Okay.
International Association of Oral Medicine and Toxicology is our association
Okay.
of biological dentists who use ozone. Some do use the oral DNA test, although not everyone. It's important to ask these questions whenever you call a dental office just to make sure they offer whatever is in alignment with you.
Yeah, that is definitely helpful. I'll have all these great resources you're referring to in the show notes, so everybody can
Excellent.
check it there. So talk to us about Orasana. How do people find out more about it? And if they decide they want to start trying it, but they like say they're not ready to do all three steps. Say they say I like to floss my teeth the way I have been, could they start with two steps? Let's talk about the options.
I started Orasana based out of a need.
Hmm.
I was very interested as a periodontist in the microbiome layer. And in 2015, 2016, there weren't many choices of chewable probiotics. And the one that I was using, my patients didn't like. They said, "Oh my God, this tastes horrible. It is so chalky. I just don't want to eat it." And I looked, and there was nothing available. Finally, I found a chemist in Wisconsin who was willing to help me with this. And it was also important for me that I make a vegan certified probiotic because a lot of my patients had lactose intolerance and we wanted bacteria to be grown on a vegan medium.
Hmm.
So that's what we did. The good news is we tested it on kids. And the one of the first thing I hear is like, "Well, how many of these can I have? Can I have another one?" So that's how we know we have a good tasting probiotic. So
Exactly.
we have two flavors, wild berry and a soft mint.
Okay.
And it's super helpful to decrease plaque, to balance the microbiome. We know now that the strains that we're using also help decrease cavities, which is so important for kids, especially fluoride is not needed. We just need to balance their microbiome.
So by using that, if someone is prone to having elevated levels of strep mutans in their mouth, does that help to, because thinking about like the gut microbiome, when we improve the levels of healthy bacteria, it starts to knock back some of the unhealthy. Does it work that way in the mouth too? So as we improve the good bacteria, the probiotics, we can start to reduce these things like strep mutans.
Absolutely.
So that is one way people could look at if they say, wow, I've always been prone to cavities and mouth problems just by improving that microbiome and fiber, making sure you're getting the right amount of fiber, brushing, water flossing or flossing, adding an oral probiotic. Now we're starting to really shift that oral microbiome.
Yes. So
Okay.
important.
Okay. So what are some of the benefits that people may see by improving their mouth health?
Every day I see a new article on how the oral microbiome affects overall health.
Mm,
So we're still learning a lot, but what do we know so far? Back in the 1980s, we had studies to show that in pregnant women with gum disease and specific bacteria such as P. gingivalis,
mhm.
they will have preterm low birth weight babies. So
Interesting.
we know oral bacteria travels to the unborn baby, crosses the placenta. We've had studies to also show that with increased gum disease, there's 2 and 3 times higher incidences of strokes and heart attacks. Why? We have found oral bacteria in hearts, in blood vessels. Also, rheumatoid arthritis, I mentioned earlier. P. gingivalis, again, has been found in joints of rheumatoid arthritis patients. Alzheimer's, Dr. Bredesen,
Mhm.
who's a leader in Alzheimer's disease, he mentions P. gingivalis found in the brain of Alzheimer's patients. So super, super important. What does P. gingivalis do? Causes gum disease.
Mm.
But basically, what happens whenever gums bleed, there's an opportunity for this little bacteria to catch a ride in our blood vessels, and it goes places. Our immune system, unfortunately, is not perfect. And P. gingivalis has this very interesting characteristic that we call it the stealth organism because it hides itself from our immune system.
Oh.
So they all have such different behavior. And now we're starting to understand more and more that each bacteria shouldn't be treated the same. They all have individual ways of coping with staying alive. Knowing this, now we know how to better treat it.
That is so interesting. We have different strains of pathogenic bacteria in our mouth, but they don't just hang out in our mouth and they don't just pass through our gastrointestinal tract and get eliminated. They're actually hitching a ride in our brain, in our heart, in our blood vessels, and probably more places than we've even found right now. So while we're improving our oral microbiome, what do we do to detoxify some of those? We don't want them hanging in our brain or our joints or.
Yes, I forgot to mention prostate cancer has been linked to gum disease. So for men, that are going through this, definitely hugely important to look at oral health.
Yeah.
Find a biological dentist in your area who could do an oral DNA test and perform a oral microbiome reset. There's a way to do this. We use airflow technology to wipe off the entire microbiome from the roof of the mouth, the cheeks, the gums, the teeth, and really reset it. Start to build good, healthy microbiome, not just via topicals and chewable probiotic, but also through diet. And then the full body detox. Let's say we have aggressive pathogens living deeper in the tissues. How do we do detoxification? Herbal supplements. And in the Orasana line, we have a botanical cleanse product, which is antifungal, antibacterial, that we can take for longer term. I'm not a big fan of antibiotics at all because they don't work well for the microbiome. It's only like a short burst. But then if we don't do anything else, just antibiotics, things tend to go back to the way they were.
Mm-hmm.
I find that ozone, even in the form of, ozone IV, we have physicians in our area that I work with to help detoxify somebody fully, not just orally, but also via ozone enemas, colonics. We do IV ozone in order to help somebody bounce back.
So is the main diagnostic test that you do, Dr. Sanda, the oral DNA, or are there more ways that you're looking into someone's root causes to be able to design for them that oral microbiome reset?
Yes, we look at the breakdown of tissues in the mouth. It's a periocheck test, which is also a saliva test. It tells us the level of destruction happening right there and then. And then we check that after the treatment to see that we have brought it down. Because as we're testing just for the pathogenic or bacteria and the levels of it, we also want to know if the level of inflammation and destruction is going down, that means we're building a healthy level of the microbiome in the mouth. And the other thing is the physicians I work with do stool tests and oftentimes message me saying, hey, we find oral bacteria on the stool test. You need to treat them. So it's nice to work that way.
That is so nice. You have the great team approach. Is there a preferred stool test that you know of? Is it a GI map or something different?
Mostly GI map from
That one.
Genova as well.
I love that one. It tells us so much, but I never thought as a practitioner to look for oral bacteria. So very interesting.
I
Oh,
think you bring up a good point. So I think at one point I have to put together just a small class, what kind of bacteria we should look for in the stool, just to have it as a free resource on our page for practitioners like you who want to learn more about that.
right, because then I can see a collaborative approach of saying, hey, it always makes sense to work with a biological dentist. And you're making that extremely clear here. But then there are these synergies we bring together that either one of us can help people really move the needle. But when you get it all together, then it's exponential healing. And that's when it gets even more exciting.
Amazing.
Okay, so as we wrap up, I'll have the links to Orasana and all the different shout outs you've given today. Is there anything else that we haven't talked about that you would like our listeners to know about? You might want to try it home. They're definitely going to be looking into Orasana, but anything else? Increase fiber, what else?
One of the things, Lisa, I want to mention is a lot of people lately that have come to me with Lyme disease, brain fog, chronic fatigue. We always look at what microbes in the mouth or what kind of silent infections could be causing or contributing to these symptoms. So we look at root canals and cavitations. We haven't talked about cavitations, but how did I discover the word cavitation? I went through a surgical residency at UCLA and I never knew this existed until I went to the Institute of Functional Medicine. And one of the physicians was talking about his patients who couldn't really heal until they had their cavitations taken care of.
Ooh, let's talk about what a cavitation is.
A cavitation is basically a hole in the jawbone where a tooth was removed or where a root canal tooth is leaking microbes in the jawbone.
Mm.
The way to identify this is via a cone beam CT scan. Why? Because two-dimensional x-rays don't show us much at all. They only diagnose about 52% of the problems, which is pretty low, whereas 3D technology allows us to see all the issues.
Okay.
And how do we treat it? Basically, we remove the microbes from the jawbones, and I always biopsy what comes out of there. On my YouTube channel, I actually have some videos. If anybody's interested in seeing what comes out of the jawbone when there's a cavitation. And what's interesting is like it's not just bacteria, it's also we find parasites. 70% of the time, we do find parasitic activity in the jawbone.
What would be a common parasite you would find in the jawbone?
The antamoeba species. We don't know how amoebas get inside the jawbone.
Mm.
Once they're there, also we find Lyme in
Mm.
the necrotic areas.
That could be why it's resistant to treatment if someone's doing all the right things.
That's exactly right. We have to remove these necrotic areas of the jawbone where organisms can hide. And that's when we see people getting better and moving a needle with their Lyme disease treatment.
What about mycotoxins? I could see that might be an area where mycotoxins could hide out too.
Absolutely, especially with root canal treated teeth. Oftentimes, when I take out root canal treated teeth, they're black. And I started to work with a lab who actually tests for mycotoxins. We are finding mycotoxins and mold in root canal treated teeth. It makes sense when we think about it. These are dead teeth. The mouth is moist. It is warm. It's the perfect place for mold to grow.
Yes, that's exactly.
Mhm.
Mold loves decomposing and, it loves to gravitate toward things that are decomposing.
My advice, Lisa, a lot of people have root canals and say, oh, I don't feel anything. Look in the mirror, check on your root canal, see, is this starting to turn dark? If it's
Mm.
starting to turn dark, it's a sign that there's toxins, there's bacteria, mold overgrowth inside that tooth.
There could be so many mystery symptoms related to these cavitations. Again, this has been a mind-blowing episode because this layer of knowledge makes so much sense when you get someone so far in their health and you're like, we're just missing something, but we're doing all the right things.
Yeah.
This could be one of the answers in the journey.
Yeah, absolutely. And it is my mission to educate, to talk about this. I've been practicing now for 20 years. I can't believe it, but it's been that long. And I want to leave this knowledge and the treatments we do here to the younger generation of dentists to help patients because it is the biggest satisfaction for me to see patients feeling better overall, not just helping them with their smile, but how they feel overall.
Yes, you're leaving a legacy for more people to get this wisdom and knowledge and improve lives, which is amazing.
Yeah.
Tell everyone how they can tune in, find more about you, find Orasana. So let's talk about your website. You have a podcast, your YouTube channel. This.
Yes. You can also find me on Instagram at Dr. Sanda. I'm posting a lot of information and news about the oral health and how it's related with the body. BeverlyHillsDentalHealth.com. That's information about biological dentistry and the way we practice, the kind of procedures we do. Orasana.com, you can find information about the oral microbiome. We have a whole resource page there with different articles, how the oral microbiome is related and what you can do about it.
And what about your YouTube channel?
Yes, my YouTube channel at Ask Dr. Sanda. I post a few videos on different tools that you can use for home, different options for treatment, as well as videos and things that I see in the mouth that we post on there. The Holistic Dentistry Show podcast.
Very good. And if anyone's listening and just taking notes and not waiting to check the show notes, Dr. Sanda, so it's DRSANDA.
Yes.
This has been so much fun. Oh my gosh. We could just keep going and going.
It was fun. Yes, it was fun. Thank you so much for having me.
Thank you for coming. And guys, everything will be in the show notes. And thank you for listening today. I love when you join us. I will be back next week. Until then, stay pretty well.